Johnson County today on KOKO. We continue with some folks from Western Missouri Medical Center. We have some nurse-certified midwives with us today. Krysta Ramirez Henry and Jillian Simmons. How you all doing?
Good, thanks.
What's a midwife? Who wants to start with that?
Okay, so
Jillian's going to
yes, I'll go ahead and start.
take that question.
So Krysta and I are both certified nurse midwives. So we both had nursing backgrounds, and then we both decided to go back to school and get a graduate degree.
That's different than just a nurse. Do you have to be a nurse first?
To be a certified nurse midwife, you
Oh,
do
okay.
have to be a midwife or a nurse.
The word
first.
certified is
Correct.
important there then, huh?
It is. It distinguishes us from other types of midwives that practice in the community. We have prescriptive authority. We are advanced practice registered nurses. So that's how we have privileges at the hospital, can do work independently in some states, versus a practical midwife. That's more of an apprenticeship.
Uh-huh. How many of you are there at Western Missouri Medical Center?
There are 4 of us.
There are 4.
4?
Mm-hmm.
And the main purpose is what?
To provide reproductive health care in the community. So primarily we attend births and do prenatal care, but we can do full scope care as far as annual exams, STD checks, family planning,
Not just deliver babies.
Not just deliver babies, correct.
All kinds of
Yes,
things
We
then.
can.
Yeah,
And
okay.
I-
Do you go ahead, I'm
No,
sorry.
you're fine. I think the thing with being a midwife is it's one of the oldest professions. So, you have this long history of what midwives are. But the basis of what a midwife does is we focus on normal physiological birth and talk about low intervention. But we work in the hospital setting, so we're able to intervene as we need to with more medical management as needed. So,
Are you supervised by a doctor, or are you on your own in delivering children?
We do have physicians that we collaborate with. We're part of a group. So really at this setting, when you have a midwife attend your birth, you're having a physician as backup readily available. We do it as a partnership. So if I have a patient in labor, my collaborating physician is going to know that patient is there. If I have any concerns about how her birth is going, I'm going to be in touch with that physician
Okay.
so that they can assist us if we were to need to do a C-section or something of that
Okay.
nature.
How long have each of you been at the hospital?
I have just celebrated my 10th year this summer, so.
Oh, this is not new to you then, huh?
No, not at all.
How about you, Jelly?
so I've almost been here for 2 years.
Almost 2.
Almost 2. It'll be 2 in February. So.
Okay, well, that's close enough. Close enough. What brought you to the hospital? Start with you,
So
Jillian.
actually, Krysta was one of my professors during my graduate degree, and she reached out to me. I was working as a labor and delivery nurse in St. Joseph, Missouri. I'd been there for almost 7 years, and
Working as what?
a labor and delivery nurse.
Oh, okay.
Yeah. So she just reached out to me about a position that was coming open, and yeah, that's how
So
I came
this
to
is
Sarah.
that really quite an advancement to do what you're doing now, as opposed to just a labor and delivery nurse?
Yes, it is. Because
Takes more of a degree?
Yes, Krysta and I both have our doctorate in nursing practice. So we both got, our terminal degrees. Some certified nurse midwives have master's degrees and some have doctorates. The nice thing with having a doctorate is, we can look into evidence-based practice and apply that to our current practice.
Yeah.
But we also are able to see patients in the clinic and hospital setting, and it's more independence. We're able to order things. We're acknowledged by all 50 states. So.
But you know why I'm smiling?
Why?
Could be rather confusing calling you doctor.
Yes.
Well, and that was a big debate because we earned the title, and so we were
Yes.
saying we should introduce ourselves as doctors, but it does get confusing.
Yes.
I would think it would.
But I am a doctor. I'm not a physician. There is a difference, and that's why we also try to be very careful in the language
Yes.
we use by referring to the physicians we work with as such.
You don't say doctors.
Correct.
Yes.
You work with physicians and you are,
We are technically doctors.
Yes.
yes, okay. With a degree as,
Yes.
Yes.
We have a doctorate of nursing practice.
yeah, okay. Why did you come to the hospital here?
Well, when I was
10 years ago.
yes, when
Yeah.
I was interviewing, I fell in love with the group, Connie and Gail. They started this practice back in '99, and I just loved what they did with the practice. I loved how the hospital supports midwives. They support how we want to labor our women. You know, we have huge tubs, beautiful tubs at the facility for women to labor in. We have all the latest and greatest gadgets, if you will, to assist women with laboring. And so you don't find that at every hospital. You know, some hospitals are like, she's in labor, let's get her an epidural, put her in bed and leave her there. And these nurses have no problems when I say we're getting the patient in hands and knees and that's how she wants to deliver. They will do that for me and they don't push back, and I love it because they support normal, natural birth with us.
Do all hospitals have midwives?
No.
Is it rare?
It's not rare, but this is a very unique facility with how much they let us practice like we want to, like
Right.
real, I hate to say real midwives, but where
We get more autonomy.
we have a lot more autonomy. We can, less interventions are forced on our patients. So.
And we have really good physician support and, like she said, nurse support. Everyone is very familiar in the community with having midwives here, which I think in itself is really nice because not everyone knows what a midwife is and what we do and what we have to offer. So,
and you know, we do most of the births for the community.
we
the
do
midwives.
we did 53% I think last year.
I have assisted in over 1,000 births since starting here.
Really? What's the difference then in a midwife and a doctor who delivers a baby? Is there any difference at all?
There is.
There is. So they have a medical degree and they are surgeons. We are not surgeons.
But you've got a medical degree, do you not?
So we have a nursing basis, and there's a difference between nursing basis versus a medical basis. They are true physicians and are able to do more like surgeries and different medical interventions that we aren't certified to do.
Uh-huh.
And if you have a high-risk patient that has a lot of pre-existing conditions, we want the physician there to help take care of
Yes.
them because you're managing more than just the pregnancy at that point.
Right.
Another thing patients will see with us midwives is when we are on call, we do not do anything else. We are just assigned to the hospital to be with that person while they're in labor. So if a woman pushes for 4 hours and wants us with her for that 4 hours, I will be with her that whole 4 hours. Our physicians, they're really busy. They're seeing patients in the clinic, helping in the OR, getting called to the ER, that kind of thing. So they are more of the traditional mindset, how you see the physician coming in at the last minute, basically to catch the baby.
Yeah.
So they're not able to give that bedside support that we are able to do.
You all do catch the baby, as it were?
Yep.
Yes.
We catch baby, we do some massaging during labor, we do, just the mental health support too. There's a lot of evidence that shows a decreased rate of C-sections if you have a midwife or a doula at your side to help with your birth.
Yeah. If we didn't have midwives, it'd be kind of tough, wouldn't it, at the hospital for doctors who have a lot of patients to see? And
It would be very hard for
Yes,
them.
it would be. It's actually projected that there's supposed to be, not enough like GYN and women's health providers come 2030. So, for us, it's nice that we're here in the community because some communities that are more rural like us are finding that they don't have prenatal care available because of the lack of providers.
Are there midwives at some of the hospitals in the city? And the big
There are,
hospitals,
yes.
Research or
Yep.
St. Luke's, places
Yes.
like that?
Yes.
And are there some that do not use them?
There are many that do not use them. There's, a little bit of turf wars amongst physicians and midwives sometimes. So there's that competition.
Yeah.
I think though that when a physician works with a midwife, gives it a try, they realize we are really not a threat. We have different clientele. Like I said before, the high risk, we want our physicians to take care of.
In our group right now, we do like an interprofessional collaboration when it comes to our patients. We make it so that all of our patients meet all of us. It's a group practice. It's not just individual. So we try to make it so everybody meets everybody, so there's not a stranger at your delivery, or say you have to have a C-section, you know the physicians.
Is there any follow-up?
Yes, we do postpartum care, and then again, you know, we can do annual exams to follow up. We
do birth control consults, we do all sorts of things.
Before birth and after?
Mhm.
Do you see patients, pregnant ladies come to talk with you and visit with you about their pregnancy like they would a doctor?
Yes.
A physician, I should
Yes.
say.
Thank you. Yes.
Yes.
You've taught me something today,
Yes.
something else. I have a compliment for you, for your part of the hospital. I'm not sure whether it's for you folks or not. If it's where you work, because I just mentioned to you earlier that I had a new great-grandson born at the hospital last week. And my grandson told me that he was really appreciative of what went on there during a tough delivery for my grandson. So
Yeah, we have a great obstetric unit. The nurses there are amazing. They really are. They give great one-on-one care.
he said there was always somebody
Yes.
helping,
Yep.
always somebody there when
We
they
have great
needed somebody
lactation
there.
consultant that works with our moms too. So
And our surgical techs that help in the OR, they're good about helping even in the labor room. So
Yeah.
we're nice. It's nice.
the whole
to have,
team,
yes.
the front desk people, our housekeepers, the whole
Yes.
group is
It
great.
definitely takes a full team to make our unit work. So
Anybody keep track of how many babies are born a year at the hospital?
Do you know that number off the top of your head? We
No.
do keep stats like that. That's why we
I
knew
wanna
that we
say
did
it's like-
53% of the births.
53% of the births is
The
done by-
midwives did last year.
midwives did. More than half of births. Some don't use midwives.
Some are not able to because, again, there are some high risk. And then others just feel more comfortable with a physician, and that's okay too. So,
Yeah.
some people think that as a midwife, we only do out of birth hospitals, as our group only does in the hospital.
right.
And there is the misconception we don't allow for epidurals. I'm a big advocate for epidurals,
Yes.
so you can get an epidural with a midwife.
Yes.
That takes some of the pain away.
Oh, it takes all the pain away if you're lucky. If you're lucky.
Yeah.
And really I think throughout the whole U.S., there's 90% of midwifery care is done in either the hospital or birth center, whereas a very small portion is done at
Yeah.
home.
Midwifery is what it's called,
Yes,
right?
Yes.
midwifery.
Now, I have a question. Are there many male nurses involved in midwifery?
There are a handful. I'm also an instructor at the University of Kansas, and we do have a male student coming up. So
Really?
Awesome.
You teach at the University of Kansas?
I do.
How do you do that and work here too?
I'm part-time here.
Oh, are you full-time or part-time?
I'm full-time.
Full-time. How many of you are part-time?
I'm the only part-time.
You're only part-time because you have that job
I'm teaching
teaching.
the next generation of midwives.
That's
who
what
that
you're
truly
doing.
is.
That's where you came from.
And
Yes.
Emily, one of our other midwives, was also a former student of mine. And then Rachel is another new midwife we have, but she's totally new to the area. So
Okay, I want to tell people who I'm talking with you right quick. The teacher is Krysta Ramirez Henry.
yes, correct.
And Jillian Simmons.
Yes.
Been there, how long did you say?
Almost 2 years.
Almost 2 years. And Krysta's been there
10.
10.
Krista's really our lead.
Have you
midwife.
been part-time that whole time?
No, only for about 2 years when I decided to start doing some more teaching. Because we also do a lot of precepting in our clinic where we get not just midwifery students, but other advanced practice students.
Yeah.
And I enjoy that, so I wanted to branch out and do a little bit more of that teaching. So that's why I was able to do part-time.
Is it a growing part of medicine today?
Yes. All advanced practice is growing.
Right.
But midwifery especially because we are projected to have in the nation, they call it obstetric deserts, basically where you can't get obstetric care within an hour of your house.
Yeah.
And so they're really promoting it.
Obstetrics desert?
Yes.
Nothing
Kind of a
there.
fun word, huh?
Yeah, it is. Anything else, ladies? Doctors?
Thank you.
Yes.
No, thanks for letting us come and tell a little bit about what we do here.
Yes.
Well, very interesting to talk with you, and I appreciate you taking time to explain to our listeners about what is available at our hospital, Western Missouri Medical Center. Krysta Ramirez Henry and Jillian Simmons, our guests today on Johnson County Today.